My name is Akisan Olusegun Joseph, and I have other colleagues that are here with me, um, doctors and medical practitioners, and we will be anchoring these together. Okay, fine. So we will be looking at this outline, the definition of blood pressure, how to measure your blood pressure accurately, how to control your blood pressure, benefit of good control, and impact on longevity. So blood pressure is the pressure or the force exerted by the blood on the blood vessels, that's the arteries, as it flows from the heart to the organs, as it flows from the heart to other organs. And it's important that we know that it has two components: systolic blood pressure, the upper one, and diastolic blood pressure, the lower one. Okay, systolic blood pressure, most people focus on the systolic blood pressure and they neglect or forget about the diastolic. You ask most patients, what's your blood pressure? They say it's 130. 130 over what? 130 is not complete. That is just the systolic. The diastolic blood pressure is as important as the systolic blood pressure. All right. So it's important that when you are asked what's your blood pressure, mention the two: 120 over 70, 120 over 80, or, as the case may be, it's important. The systolic blood pressure, which is the higher one, is the pressure or the force exerted by the blood as the heart pumps, the blood. So as the heart contracts, the force that the blood impacts on the vessels as it flows to the organs, that is the systolic blood pressure. And diastolic blood pressure is exerted as the heart relaxes to receive blood. All right. So when the heart relaxes, there is also a force that is generated by the blood in trying to move on towards the organs. That is the diastolic blood pressure. And this is the way I say systolic superior, that's higher, the upper one. Diastolic down, diastolic down, that is the lower one. So systolic blood pressure superior, that's the higher figure. Diastolic blood pressure down, the one down, below, that is, the diastolic ones. Both of them are very important. And when you are reporting your blood pressure, once again, try to mention the two. Okay, very important. Okay, so this is, a diagram. Systolic pressure is the measure of this pressure within the arteries while the heart beats. This is while the heart is contracting. The systolic blood pressure, is the one that tells us the force that the blood impacts on the vessels as it flows. And while the diastolic is when the heart relaxes. All right, when the heart, is not contracting, the blood pressure when the heart is relaxed, not contracting. Blood pressure fluctuates from minute to minute. And blood pressure shows a circadian rhythm over a 24-hour period. It's usually higher in the day and lower at night. At night, the system begins to get ready to sleep. And while the system is getting ready to sleep, while your body is getting ready to sleep, the hormones that are released to keep you active, to keep you, strong and moving on, those hormones begin to drop in quantity, so to speak. And that also makes the blood pressure to drop to an extent. So usually the night blood pressure is lower than the day blood pressure. And when you're sleeping, it's even lower. However, for some people, it's high. When it is higher than the daytime, it's a problem on its own, whether the person is hypertensive or not. But we're not going to talk about that today. That's a different thing entirely. All right. There's usually mild variation in the blood pressure between both arms. Usually, it's less than 10 millimeter mercury. All right. So sometimes you find out that you check your blood pressure on the left and maybe it's a bit higher than the right or vice versa. All right. So, but usually it's not going to be more than, 10 millimeter. It should be less than 10 millimeter mercury. The only way to measure your blood pressure, the only way to know your blood pressure, rather, is to measure it. There is no other way. If you don't measure the blood pressure, you cannot know what it is. Some people say, oh, I know when my blood pressure is high, when I begin to feel somehow, when I begin to when I have a headache, when this is happening, when that is happening. No, it's not enough. Those things are not, a measure. Yes, they can indicate that maybe your blood pressure is high for those who who have found that as a pattern. But the thing is, this before you even start having those symptoms or those I mean clues, all right, the blood pressure might have been high for a very long time. Remember, it's called a silent killer. You may not have any symptoms, the blood pressure may be high. So the only way to know your blood pressure, what the reading is by measuring it. So please go ahead to check your blood pressure. If you have not checked it for quite a while, if you have the apparatus, measure it today before you sleep. If you don't, try to measure it this week. This is another week. It's a Sunday, so this is another week. From tomorrow, you can try get to a facility where your blood pressure can be measured and at least know what it is. It's very, very important. So blood pressure is measured by using sphygmomanometer and a stethoscope. That's where it started from. So there's a mercury sphygmomanometer, and when this is used, a stethoscope is also necessary. There's an aneroid sphygmomanometer. These are to come in because of the the deleterious effects of mercury, especially if it spills, which does happen sometimes. So the mercury sphygmomanometer is being phased out. Also the aneroid, it's time, it's numbered, so to speak. The one that is usually that is in high demand now and is being used and also have been validated in so many studies at the digital sphygmomanometer. So it's been used and it's very easy. You can check it yourself. You don't need a stethoscope, for that. For these first two, you need a stethoscope. But for digital sphygmomanometer, you don't need a stethoscope. All right, just put it. If you can place it correctly, you can measure it yourself. So for this one that we're seeing here, you can see 109 over 64. So the systolic is 109, while the diastolic is 64. The third reading there is the pulse rate. That's the heart rate, 81. This is a good reading for this person. 109 over 64, and the heart rate or the pulse rate is 81. All right, so the pulse rate is 81. That's good. So this is, usually put at the four. There are some devices that have wrists, that makes use that are placed on the wrist. Okay, the wrist and blood pressure measuring apparatus. It's okay, it's fine, but it's not as accurate as that one that you place on your phone. It's not as accurate as this one that we're showing here. So please, if you have the wrist um, um, blood pressure measuring device alone, please, while it can be a guide for you to know what your blood pressure is, try your best to at least check with the digital one, the one that you put on your forearm, once in a while, that you put around the your arm once in a while, and get the accurate measurement of it. All right, normal blood pressure is between 90 and 60 over 120 to 80. 90 to 90 to 120 over 60 to 80. So the systolic usually between 90 and 60, between 90 and 120, and the diastolic between 60 and 80. All right. When it is higher than that, from 121 to 139 over 81 to 89, we say that the person has pre-hypertension. All right. That is pre-hypertension. And it's just a step away from, the person being hypertensive. All right. That is important. 140 and above. All right. 140 and above, we say that the person is hypertensive. So if your blood pressure is consistently, 140 over 90, 141 over 91, and things like that, you need to see a doctor, please. That is hypertension. And if you are listening from the US, I think we have few people that have put there that they're listening from the US. For you, the cutoff for hypertension is 130 over 80. So in the US, hypertension starts from 130 over 80. All right. So if your blood pressure is 130, 131 over 80 over 81 and things like that, well, I mean, for those in the US cutoff is 130 over 80 and above. All right. And hypotension is less than 90 over 60. This is important because some people, when they start their drugs, I'm still going to talk about it, but let me quickly mention it while we're talking about the readings now. Some people, when they start taking, antihypertensive drugs, when they check their blood pressure, if it's 110, 105 over 70, they begin to say, my blood pressure is low. Your blood pressure is not low. It is accurately correct, if I can say that. It is very, very much okay. It is well controlled. All right. Take your drugs. Make sure it's well controlled over and over and over again. All right. So low blood pressure is less than 90 over 60. All right. We need to know that. All right. So how do you measure your blood pressure accurately? Because it is extremely important. If you don't measure it accurately, you will get a wrong figure and that can mislead you. Sit well in a quiet place. And while seated, please don't converse. No conversation whatsoever. You are not talking with your child or talk if you are doing it on your own. You're not talking with your child. Go and check that thing. Bring my phone. Bring this. Do this. No. Be quiet. Why? If you talk or you engage in active talking, okay, it can increase your blood pressure by up to 10 millimeter mercury. So instead of your blood pressure reading 120 over 70, for example, it may read as high as 130, okay, over 80, depending on what you're doing, the intensity with which you are talking or the intensity with which you are, engaged in that particular activity. Number two, support your arm at heart level. Okay, support your arm at heart level. Very, very important. All right, because unsupported arm can add up to 10 millimeter mercury to your blood pressure. So don't let it just hang down. No, support it. You can put it on a table just the way this man has done. All right, put it on a table and let it be well supported. Number three, put the cuff on bare arm. Okay, put it on your bare arm. Not over your cloth. Put it on your bare arm and let it be well fixed. All right. So if you wear a thick clothing, it can exaggerate your blood pressure by 5 to 50 millimeter mercury. And sometimes we've had that in clinic. And this is another thing I would like to say. If you're going to clinic, wear something quite, free on you that you can roll the sleeve. All right, so that you don't need to pull off your shirt or pull off, your top for them to check your blood pressure because what you are wearing is very, very tight. All right. We've had people that, oh no, okay, just put it like that. And by the time they get to the examination room proper and the doctor says, no, I'm not comfortable with this blood pressure. Let's recheck it, remove your shirt and then lie down and let me check it for you, or remove your shirt, let me check it for you. By the time you check it, is lower than what they got what the nurses have recorded. Not that it was wrong, but that what you were wearing have actually added to it. So when you're going to the clinic, please wear a loose cloth where you can easily roll up the sleeve of that particular top. Use correct cuff size is extremely important. Small cuff size will increase the blood pressure by 2 to 10 millimeter mercury. And when it is too loose, it can reduce the blood pressure as well. Let your feet be unsupported. So don't cross your legs. All right. Let your feet be supported. Sorry. So make sure that if you are seated, your feet are touching the ground. All right. They must touch the ground. If they are dangling, it will add up to your blood pressure. Keep legs uncrossed. If you cross your leg, it can increase your blood pressure by 2 to 8 millimeter mercury. So keep your legs uncrossed. All right. If you are pressed, empty your bladder before you check your blood pressure, because a full bladder can increase the blood pressure by 10 millimeter mercury. So you can see some, and we'll do some of these things. All right. We're talking, some people are talking on phone and they're checking their blood pressure. Some people are actively talking with somebody and they're checking their blood pressure. Some people will just cross their leg, cross it very tight, and they're checking their blood pressure. Some people are pressed and they say, oh, let me just quickly check my blood pressure before I go to ease myself. No, ease yourself, empty your bladder first. Okay, and then support your back. Don't just allow it to hang loose. Support your back so that you are well rested. Okay, and then that will help with the blood pressure. Unsupported back can increase the blood pressure by 6 millimeter mercury. Okay, so how to control your blood pressure? Two major ways. One, lifestyle modification. There are things that you can do to make sure that your blood pressure is well controlled. And then number two, pharmacological management. That is drugs. Okay, for those who on drugs, there are some tips we're going to share here that is going to help you to be able to adhere to your drug therapy. Okay, so the first is lifestyle modification, very, very important. And then the second is pharmacological management. So let's start with the lifestyle modification. Physical activity. Engage in regular aerobic physical activity. For example, brisk walking for 30 minutes and above most days. WHO says at least 5 days in a week. That will reduce your blood pressure by approximately 4 to 9 millimeter mercury. So if you're hypertensive, this will really, really help. All right. So, engage in physical activity, brisk walking, and you don't need to create, if you have a special time, if you have a special time for it, that's fine. Okay, but even for those that say, oh, I don't have time, you know what, you can still engage in physical activity. Instead of taking the elevator, take the staircase. Instead of parking very close to your place of work, park a street away and trek down. That's physical activity, and then you can walk briskly. Or park at the farthest end of your parking lot, all right, and then trek into your building. All right, that would have helped you a bit. At least you'd have engaged in some count step. All right, that is extremely important. All right, while you are taking calls, instead of sitting down to take your calls, you can pick up your phone and paste. Even if it's in your office, while you're taking that call, you can get up, make every call a walking call. That will increase your step count and it will add up to aerobic physical activity. So there are ways to go about this thing. All right, you don't need to dedicate 2 hours. Oh, I don't have 2 hours a day, I don't have 1 hour a day, I don't have 30 minutes a day. You don't. Yes, it's good if you have it, but even if you don't, you can create this thing. Every one of us, I'm sure, receives call every day or have calls to make a call one time or the other every day. Make your call time your working time if you are very, very busy, and you'll find out how it's going to help you. All right, dash eating plan. Consume diet rich in fruits, in vegetables, low fat, dairy products. That will reduce your blood pressure by 8 to 14 millimeter mercury. All right, reduce sodium consumption. All right, that will reduce your blood pressure by 2 to 8 millimeter mercury. You can see how these things are impacting on blood pressure. Reduce or stop alcohol consumption. That will reduce your blood pressure by 2 to 4 millimeter mercury. Weight loss. Okay, maintain normal body weight. Okay, the normal body mass index is between 18.5 to 24.9. In some quarters is 20 to 24.9, but the cutoff should be 24.9. 25 and above is overweight. So 25 to 25 to 29.9 is overweight, and 30 kg per millimeter squared is obesity. For every 5 to 20 blood pressure reduces by 5 to 20 millimeter mercury for every 10 kg weight loss. So somebody that is weighing 100, by the time the person reduces up to 90, some blood pressure, would have also gone with the weight that is shed. So try to maintain adequate body mass index. How do you get your body mass index? Body mass index is weight over height squared. So if you have the opportunity to write down, you can say weight divided by height divided by height. Your weight in kilogram, your height in meters. So if your weight is say 90 kg, all right, and your height is 1.7 kg, 1.7 meters, your BMI will be 90 divided by 1.7 divided by another 1.7. That will give you your BMI. Stress reduction. If you reduce stress, and there are so many ways to reduce stress, it will reduce your blood pressure by 5. And then tobacco cessation will do that 2 to 4 millimeter mercury. Increase your fruit intake, your whole grains and nuts. Limit intake of sodas, sugar sweetened beverages. Take healthy beverages, okay? Take healthy beverages. These are things that will help you. Healthy beverages like tea, healthy beverages, green tea, and the rest. Dark cocoa, dark chocolate is also quite good. Aim for a healthy weight. We've talked about that. These are things that will help. Take a break when necessary. All right. It's important that we do that. Um, uh, you need to go on vacation. You need to take a break. It's very important. It will help your system to reset, and especially in this our busy environment, busy world, busy client. Please take time to have a break for yourself. Deal with negative emotions. Negative emotions will cause a lot of stressors and stress hormones to be released, and that will increase blood pressure. Stress management is extremely important as well. All right, one of these days, one of the topics before the end of the year, we're going to talk about stress management. All right, cultivate positive emotions, be cheerful, make room for humor. Very important. And you can put a program that is just without strings attached, not just a program that will help you to that will lift up your spirit and create positive energy around you, and make you to laugh. Sometimes you can engage in it while you're unwinding, while you're trying to take a rest, during the day, or at least, sometimes during the week. All right, reduce, stop alcohol consumption, and also energy drinks. Energy drinks are drinks that are very much high in caffeine, okay, and they are extremely dangerous for our health. And you find out that so many people take it, and they are very very captivating, what do you call it, adverts, for them, Mountain Dew, Power Horse, Monster, and all of that. All right, I tell people, I say, you cannot. If you take power us, you can only imagine what will happen. Your body will, your heart will begin to beat like that of a horse, and your heart will complain, and your blood pressure will go up. So please, the energy drinks, let's stop it. If you indulge in such, reduce exposure to pollutants as much as possible. Noise pollution, air pollution, all forms of pollution, they have a way of impacting on blood pressure. But we can't go into that now. It's beyond what we're considering for today. I think we've taken it before, cardiovascular continuum. We have, for those who are joining us for the first time, you can check our YouTube, an hour with a cardiologist. You will see, the past editions there. You can click and listen to the ones that you will that you want, the ones that will address your cardiovascular needs. Pharmacological management. There are many drugs that are effective in the management of hypertension. It is above the scope of this meeting, because obviously I don't want to start mentioning names of drugs and then tomorrow somebody will just say, the doctor mentioned this, let me go and buy it. And will not go to his or her, physician or doctor. No. So we're going to reserve that. We're not going to talk about it at all. All right. Because we don't want to encourage self-medication. Meet with your physician or cardiologist for effective drug management. That is extremely important. And once you are placed on a drug, please take the medications as prescribed. If you have issues with your medications, get back to your doctor, get back to your caregiver, get back to your cardiologist. It's very important. You must develop a relationship, an active relationship with your doctor. Doctor, since I started taking this drug, I'm having this. I don't know. Could this be could the drug, let me, be a cause for this? And most of the things that we talk about, oh, I'm having this, I think is as a result of the drug. Most of the time, things are not, most of the time, these things are not the cause of whatever we have. So please, we need to be very, very intentional about this, to know that it is very important that you liaise, to communicate with your doctor. Don't let things go just like that. Don't let things slide. Communicate with your doctor. All right. Oh, I'm feeling this. I don't know what. And your doctor, even if there is a side effect of any of the drugs that you're taking, there are always replacements. It's what your doctor will just do is to replace that drug for you. So don't assume. Have a very, very good relationship with your doctor. And I must say that, yes, I mean, your doctor can be a very, very busy person. So if he doesn't answer you immediately, or if she doesn't answer you immediately, don't take it on that person. You can send a text message. If the person sees it, I'm sure he or she will respond to you. All right. Take your medication at a special. So let's look at tips for improved adherence, because if you can take your drugs, as prescribed, then it's very, very likely that you will be able to control your blood pressure. So take your medications at specific time as much as possible. If it's morning, let it be morning. If it's night, let it be night. Don't just say, oh, anytime I remember, I'll just take it. No, let it, fix it to a specific time as much as possible. That will help you to adhere to the medication. Tie it to an activity. You can take for example, you can say, immediately I finish taking my breakfast, before I get up, I'll take my drug. Immediately I finish taking my lunch or my dinner, before I get up, I'll take my drug. My dinner is not complete until I take my drug. That's very, very important. It will help you. First thing I will do once I get to the office is to take my drug before I start looking at the files and things like that. Before I start attending to matters of the office, I will take my drug. These are things that will help you. Set an alarm to remind you of the time to take your drug. Okay. If you are so busy and you cannot tie it to any activity, then set an alarm. All right. Have the drugs well sorted out in different containers with, bearing the days of the week. All right, that will also help. Have a reward system. Reward yourself at the end of the week, at the end of the month, if you are able to take your drugs daily as at when due. You can reward yourself, okay? The reward can be just look for something healthy. Look for an activity or something healthy to reward yourself with that. Oh, I took my drugs regular. And you can even have a diary for it. I've taken my drug today, you take it. By the end of the week, you look at it: Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. I've taken my drug. Oh, wow, kudos. You can give yourself a star. You can anything that will just encourage you to do more. But make sure whatever you reward yourself with is healthy. Have an accountability partner who can remind you, cheer you on, etc., if possible. So this is the type of case I'm talking about. All right. So if you look at this, you have Saturday a.m., Saturday p.m., Friday, okay, Sunday a.m., Sunday p.m., Monday a.m., Monday p.m., and up to Saturday. All right. You can have such a case like this drug case. All right. And you, at the beginning of the week, just put your drugs, put them according to the way they're supposed to be taken. When you get home, at night before you sleep, if you look at the case, you can see and say, okay, fine, I've taken today's zone. And then you take your stuff, and, that will really, really help. So Measure your blood pressure accurately, control it, live longer. We've tried as much as possible to look at how to measure your blood pressure accurately. We've looked at how to control the blood pressure. Now we want to look at how will it impact on longevity? How will it impact on your life? Not just live longer, but live live healthier lives. Because when you take your blood pressure, when you control your blood pressure, it will impact on your overall health, your cardiovascular health, your overall health. All right, it will impact greatly on it. The quality of life it will impact on, because it will reduce the chances of coming down with, complications and all the rest. All right. Why do we need to control our blood pressure, and what is the impact? One, hypertension is the leading risk factor for death globally. And this has been as far back as year 2000. All right. It's always been the leading risk factor for death globally. All right. That's one. Two, fast forward 2010, hypertension still retained its position as the leading cause of death globally, the leading risk factor for death globally. Hypertension related deaths, all right, stroke, heart attack, heart failure, kidney problem, kidney problems like kidney failure, peripheral arterial disease, all sorts. Hypertension is usually, I mean, a factor in the mix. All right. So it's important that we control. If you can control your blood pressure, a lot of deaths will be cut down, will be reduced, or no, will be prevented. It's extremely important that we know that. Fast forward 2019, hypertension still retains its number one spot. In short, the gap is even longer, is even more wider. All right. Hypertension is still the leading risk factor for death globally. So if you can control it, then the odds of living longer is better. Very, very important. We shouldn't joke with our blood pressure. And there are people who joke with their blood pressure, who will say, oh, I just didn't feel like taking my drugs. I just left it. And when last did you take it? 2 weeks ago, 2 months ago. And I'm like, do you love yourself? Because that is really the question we should ask. How will you? I mean, no man, no woman, nobody will, see a potential for death and say, oh, yeah, come, be coming. I welcome you. Nobody will do that. But many people do it by the choices they make if they don't, control their blood pressure. If they don't take their blood pressure medications, if they don't adhere to lifestyle modification that can, help you in the control of your blood pressure. It is extremely important. Hypertension related death is still the most common death worldwide, and not just worldwide, even in our country. And I'm sure that everybody listening on this call, everybody listening to my voice can attest to it, to one fact that you must have had, or you must have heard of somebody who died maybe as a result of stroke, who died as a result of heart attack, who died suddenly, something that connects with hypertension. And for some of us, we actually have them as loved ones, as relations, as colleagues at work, as neighbors who just died like that. All right, as a result of hypertension related, illness. We want to drive this down. So we need to take responsibility of our blood pressure. So importance of treatment and importance of getting your blood pressure control. It leads to a good control of blood pressure, and once it's well controlled, it will prevent the development of complications. It prevents development of complications, enlarged heart failure, heart attack, stroke, kidney problems, even eye problem. All right, peripheral arterial disease, and so on. And if for one reason or the other, because people come to us at different stages, in the hypertension journey or in the cardiovascular journey. All right, we've treated cardiovascular continuum. You can go through cardiovascular continuum 1, 2, 3, 4. I think you can watch it on YouTube. All right. Now, if you come to us with a complication, it does not mean that the complication should lead you to death. It can still be controlled. So we want to prevent or slow down disease progression. We want to prevent risk of hospitalization. And if you have been hospitalized before, you don't need to be hospitalized again. We want to prevent the risk of re-hospitalization. And of course, we want to reduce mortality. And all of these are possible with good blood pressure control, with good, plan to manage your blood pressure and manage your cardiovascular health. And ultimately manage you, effectively. Very, very important. With each 20/10 millimeter mercury increase in blood pressure, cardiovascular mortality risk doubles. That's what we're talking about. So don't just say that my blood pressure is just 160/110. That is not good. I mean, you've moved far. Okay, so for every 20/10 millimeter mercury increase in blood pressure, cardiovascular mortality risk doubles. So somebody that is having a blood pressure of 135/85 is twice at risk of having a cardiovascular related death compared with somebody that is having a blood pressure of 115/75. Somebody that is having a blood pressure of 155/95 is 4 times at risk, and it goes on and on and on. If we know this thing, then we can do something about it. Knowledge is power if we act on it. So please, your blood pressure should be, if you're hypertensive, please guard it. Please check it. Please, make sure that you are concerned about it, and make sure that don't just say, today my blood pressure is 140. There are patients who come to us with a blood pressure of 200/110, 200/120, and by the time we start managing, I thank God they even came without any disastrous complication like stroke or heart attack. And by the time the blood pressure starts going down, yes, it's good. At least we are drawing them away from the red line. When they get to around 150, they say, it's good. At least I look at where I'm coming from, 150/90. That's what I'm getting now. It's fine. We can celebrate that. Well, you can do better. We can get down to 130/80, 130/70, 120/70, and thereabout. So this is very, very important. Okay. Reduction of blood pressure by 5 millimeter mercury can decrease the risk of stroke by 34%. Decrease the risk of ischemic attack by 21%. Decrease the risk of dementia by 25% and above. Decrease the risk of heart failure by 45%, 45 to 50%, and decrease all-cause mortality, and mortality from cardiovascular disease. This is important. We need to take ownership. And the primary stakeholder in the management of hypertension is the patient. If you are hypertensive, you are the primary stakeholder. Take your drugs. Okay? Take your drugs. If you have issues with it, get to your caregiver, care provider, your physician, your cardiologist, whatever, get to the person. And if a doctor is managing you and you think you need a cardiologist to manage you, tell the doctor to refer you to a cardiologist, and he or she will do that. It's extremely important. Take it seriously. It is still the #1 cause of death globally. We want to drive it down, but we will only be able to do it if we cooperate with the plan. As a patient, take your drugs regularly. All right? If you have issues with the drug, meet with your caregiver. In conclusion, hypertension is a challenging but very manageable condition. Measure your blood pressure accurately, control it, and live longer. With good management, blood pressure control is possible and complications are largely preventable. And when complications are prevented, longevity, at least the quality of life increases, and the chances of living longer is highly increased. We'll stop there for today. Thank you very much for listening. So we're going to give opportunity for questions. All right. But before we ask questions, I want some of our cardiologists in the house. You can, I would like our hosts to please unmute some of our cardiologists in the house that may want to just chip in one thing or the other. Or if you're a physician, a medical doctor, you have one chip or the other you want to put in, you can raise your electronic hand. Please, can you help me unmute Dr. Donye, Dr. Obieli, and Dr. Adekolade is there on the call. So, Dr. Donye, you can.
Okay, thank you for the opportunity, sir. And good evening to the house. I think the summary of what we've heard listened over the past 45 minutes puts emphasis on prevention. And prevention will work for any spectrum, as it were. And by spectrum, I mean for those who are not hypertensive, checking your blood pressure will make you know what the numbers are and to know when to intervene. And also embracing good lifestyle will reduce the risk of likely coming up with hypertension. And for those who are already hypertensive, prevention is still important in the sense that taking your medications regularly, embracing the lifestyle highlighted earlier, will prevent you from coming down with complications. And then, like it was rightly said earlier, hypertension attacks some vital organs. We call them the five-star organs. When it affects the brain, someone can come down with a stroke. When it affects the eyes, someone could possibly lose their vision. When it affects the heart failure, heart attack, the kidney, and also the vessels, as it were. So the key word for us is prevention. For those who don't have it, make sure we embrace lifestyle such that the risk of coming down with it reduces. And for those who have hypertension, also embracing lifestyle adjustment with the use of the medications to make sure we don't come down with complications. Thank you.
Thank you very much, Dr. Adekolade. You have something to say?
Yeah. Good evening, sir.
Good evening. Good evening, Doc.
And happy Presidential Day. It's been a very wonderful session, and then the need for us to control our blood pressure cannot be overemphasized, and there's need for us to take ownership. And managing blood pressure is beyond the four walls of the clinic. We're able to manage better if the patient take ownership. Ownership in the sense that with the coming on board of the digital equipment, patients are able to keep track, keep record of their blood pressure, and that can be related with the physician. And then the need for us to take it accurately, take the blood pressure accurately, and also prevent some of the complications, because it's cheaper for us to control our blood pressure, because it prevents you from coming down with some of the complications as earlier stated by our guy. So we need to take ownership, we need to control our blood pressure, we need to keep track of it, and we need to, and when it's high, you need to relate with your physician. The fact that don't just go over the counter and say somebody said cousin of say is on particular medication. What works for him might not work for B. So that's why it's important for you to relate with your physician. Thank you.
Thank you very much, Dr. Adekolade. All right, fine. So time for questions. If you have any question, you can raise your electronic hand so that we can give you the opportunity to ask the question. Okay, there's a question here. Please, what is the normal blood pressure measurement? Okay, I guess you joined us a bit late. Normal blood pressure is between 1 to 1. Let me quickly go to the to the place. Yeah, between you are there now. 190 over 120. I mean 90 to 120 over 60 to 80. That is the normal blood pressure. All right. Um, when it's 121 to 139, it's over 81 to 89. We say the patient has pre-hypertension. All right. And then 140 over 90 and above, we say the person is hypertensive. If you live in the US, 130 over 80 and above, the person is hypertensive. All right. So, hello, doc. Just curious, which hand is the most effective? You can use any. Use the right hand, as some physicians have an opinion it's best as it's far away from the heart. Please, can you clarify? Dr. O'Donnell, do you want to help us?
So the question again.
Which hand is most effective for blood pressure measurement?
Okay. Usually, when you meet your doctor, it's fair to have your BP checked on both of the right and the left, and then if whichever is higher for you, you might actually want to use that to check going forward. So it's better to actually check on the two sides, the right and the left, and to notice which one is higher. So you could use that as your reference point to always check your blood pressure going forward.
Okay, thank you very much. Thank you very much. So, I mean, you can use any of the hands. And then the difference between the two should not be up to 10 millimeter mercury. And we will always take the higher one, because that will prompt, action. So if your blood pressure is 140 over 95 on one hand and 138 over, say, 92 on the other hand, we will work with the 140 over 95 so that we can help you with better blood pressure control. Please, is BP 180 over 80 normal in a 75-year-old with no special complaints? All right. Dr. Dekola, did you want to help us? Dr. Bailey. I'm not sure. Dr. Bailey. 180 over 80, is it normal? Is it normal blood pressure for a 75-year-old person? Okay. All right. It's Dr. Adonye. Do you want to help?
Okay, sir. So, like the normal values were reiterated just a few minutes ago. Okay. So having a blood pressure of 180 over 80 is definitely high. And looking at that age, it's also important to look out for comorbidities. Okay. There could be other medical conditions that the individual has. Sometimes we don't just look at hypertension alone. We also look out for other comorbidities. Is this person diabetic? Is there kidney disease? And a number of other things. So the control might be a bit more tighter if there are comorbidities. So definitely this blood pressure is high, even though for this age it's still high. So you need to see your doctor and to make sure you're put on medication and to also embrace lifestyle adjustment to make us have a better control. Thank you.
Okay, thank you very much. So this is the kind of blood pressure that we typically see in the elderly. Is 75 years old, 180 is high, 80 is normal. So we say this person has isolated systolic hypertension. Isolated systolic hypertension. It still puts the person at risk of cardiovascular, diseases, of cardiovascular complications. And like Dr. Odoye has said, I mean, for this kind of person, and not just somebody who is elderly, for every hypertensive patient, for everybody living with hypertension, we will always check for other risk factors. We've discussed it here. All right, you can go through our previous recordings. They are all on YouTube. All right, cardiovascular continuum. You want to check the patient for diabetes. Is this person diabetic? Is this person, does he have increased cholesterol and all those? All of those things must be managed. So the fact that there is 80, I know that the 80 may be the thing that is, maybe influencing or making this question to come forth. 80 is good as the diastolic, but that 180 is very, very high. And most elderly patients can actually have isolated systolic hypertension. You need to treat it. This man, this woman is at risk of stroke, is at risk of heart attack, is at risk of heart failure, is at risk of kidney problem. That blood pressure got to come down. But of course, the patient will need evaluation, real evaluation, so that every other comorbidities, co-risk factors can be dealt with. What is the relationship between high cholesterol and blood pressure? We'll deal with that. But quickly, please help me to unmute iPhone. iPhone, you have the floor. You can ask your question. And after that, Fumi is raising the hand also. You have the floor. You can ask your question. So please go ahead, please. iPhone, apologies with your name not showing. So
good evening, Dr. Akinsoya Olusegun Joseph. My name is Ola Onipekun Ladipopo. I actually want to know, haven't discussed about the MBI, weight over height squared. Is this has any relationship with walking for a particular period of time daily? For example, I take a 1.5 to 2 hours walk daily, and apparently my weight was formerly 84, but as at present I'm on 75 kg.
That's good. I clap for you.
Is that normal? But I discover I become more lighter, and some of my clothes are now no longer as tight as you be, no longer slim fit. Is that normal, please?
Okay, thank you very much. First of all, like I said, I'll clap for you. All right. So I'm trying to clap. All right. So okay. That's a good one. Yeah. Okay. Very good. Now, yes, exercise will always help. All right. I don't know your height. You can go ahead and check your BMI. If your BMI is within the normal range, 20 to 24.9 or 18.5 to 24.9, as the case may be, then you're okay. All right. Okay. That means that's just fine for us. And okay. I mean, like you said, you are lighter. Of course, you will be lighter. With when you lose weight, you get lighter, you get smarter, and things like that. Those are additional benefits of weight loss, and you feel good within yourself. And of course, your blood pressure control will also be better. I'm sure that I'm sure that you can testify to the fact that even the blood pressure control is better.
It's please fantastic now. It's
Thank
fantastic.
You very much.
My second question, please. My second question.
Okay, quickly, sir.
Yeah, sir, doctor, you say I have a heart enlargement and I have a pacemaker placement. Okay. And soon after the pacemaker placement, I continually having, even though you told me then that I should hold on, that you still want to conduct further examination before I proceed with the pacemaker. But because my children over there that were mounting pressure, I did. But soon after the pacemaker that I did in Lasut, I still continuously having this lightheadedness. Not until I visited your facility before I got over that. My question is this: is my pulse that remain 60 to 62, at times 70, is that still okay? Because I used to have that before the pacemaker. Is it 60 to 62, 70? Are they okay? Although the blood pressure are fine.
Okay, fine. Thank you very much. So let me quickly answer that so that
All right.
we can give one or two more questions or answer the ones remaining. Okay, fine. So 60 to 60, 62, 70, those are good. Heart rates or pulse rate as the case may be. The normal
Okay.
pulse rate is between 60 to 100. When it's less than 60, we say it is low. When it's higher than 100, we say it is high. All right. For athletes, they can actually have a bit of a low blood, heart rate or pulse rate because of the regular, physiological demand on their heart. So normal heart rate 60 to 100. All right. Thank you
Okay.
very much. Host,
Thank
can you
you.
help me? Yes, yes, sir. Thank you very much, sir.
Yes, sir.
Yes, sir. Host, please unmute for me. Okay, I think you must have been given the opportunity to unmute yourself now. So just click
Okay.
the icon there. Yes, go ahead, please. Ask your question.
Hello.
Yes, please. Go ahead, please.
If anyone has a blood artery, is there any other solution than bypass?
Sorry, I didn't hear that. Can you ask the question again, please? Oh, we didn't hear your question. No, can you repeat it?
Oh, sorry. If one has a blocked arteries due
Yes.
to high blood pressure, is there no other alternative than a bypass surgery?
Well, okay, thank you. It depends on the blocked arteries. It depends on the degree, the percentage block. It depends on so many things. So you will need to be assessed by a cardiologist and an interventional cardiologist as well. They of course they will have to do some tests for you, coronary angio and all of that. Look at your whole health status and everything. That will inform the decision whether to do a bypass or not. For some people, they put a stent there. It opens up the stenosed artery. For some, if it's multiple vessels and stent may not be practicable or help to deal with the issue, then they may need to do a bypass for that person. But meet with your doctor. I'm sure he will be able to help you out. Rukayat Ajoke, I think that will be the last question so that we can. And it's already 7 minutes after. Apologies, it's supposed to be 1 hour, but I know that this will generate a lot of questions. Yes, please go ahead.
Good afternoon, Doc. Thank you for the insightful talk. We really appreciate. My question is this: I do have white coat hypertension whenever
Okay.
I'm in the hospital environment, but when I check at home, I have normal readings. What can be done?
Okay. I think that Odonia has actually answered the question on. If you check the chat box, I think you will see the the answer there is more of anxiety, and you may need to see your doctor, a lot of counseling and things like that. And not just white coat hypertension may be as a result of anxiety and the rest, but then you may also need to do ambulatory blood pressure so that even the one at home can be measured while you are not anxious, while you're unaware of it. They just put a device on you. You take it home, it will measure your blood pressure even at home, even when you are sleeping as well, and then you now return it, and then they can look at it. Real white coat hypertension, blood pressure is normal at home, is elevated in the hospital. Okay, there are ways to go about it, and you know, more of trying to allay anxiety, deal with issues that may be bothering the person, and sometimes one or two lifestyle changes can also help in dealing with it. All right, but you can look at the answers that have been profiled for you, that have been given. Okay. Is one considered hypertensive if you measure your blood pressure and it's 118/78 in the morning and 124 over 24? 24 is very low. 124, I guess maybe over 74, that's what you meant. Yeah, in the night, 124, yeah, is a little bit high. All right, but we won't say that person is hypertensive. We just say that, okay, I mean, lifestyle, I mean, control and things like that. And I mean, 118/78 is fantastic. So, I mean, nobody will say that you're hypertensive with such readings. All right. Um, but lifestyle, good lifestyle choices, lifestyle practices and co will still help a great deal to help you to maintain good blood pressure. I think we are done. I'm not sure there's any other question, and I cannot see any hand raised up. So thank you very much for this period. Thank you for keeping tab with us. Thank you. I do hope that you've gained one thing or the other. Thank you, Dr. Donye, Dr. Adekolade, Dr. Billy, and everybody for everything. If you have gotten something, you've gotten value, you can just type in, gotten value. Next week. So that reminds me, please, you can sign into the WhatsApp platform so that you can get more information from us. Tomorrow I'll be having 2 interviews in 2 different radio stations. We will put it, apologies, we should have put it on this chat. We'll put it on the WhatsApp page. You can contact the person that invited you, with regards to this. And I'm sure that we will be able 9:45, 9:15 to 9:45, and then on Tuesday 5 o'clock to 5:30 Inspiration FM. But tomorrow's own, I don't have it off, and apologies about that, but we will post it immediately after this meeting. So please join the WhatsApp group so that you can get that information, or liaise with the person who invited you, so that you can also have that information and you can tune in to listen. Thank you very much. God bless you.